What are antithrombotics, and what do I need to know about them? Antithrombotics are blood thinners, that is, medicines that help blood flow smoothly through blood vessels. They prevent blood clots from forming or getting bigger, for example in patients with deep vein thrombosis or pulmonary emboli. They're also used to prevent strokes in patients with heart problems such as atrial fibrillation. There are two kinds. The first are called antiplatelets. These are drugs like aspirin and clopidogrel, and they alter the way platelets behave. The second kind are called anticoagulants. They slow the blood clotting system. These are drugs such as Warfarin, Heparin, and what we call DOACs, direct oral anticoagulants such as rivaroxaban, apixaban, edoxaban, and dabigatran. When a blood vessel is damaged and a hole is made, blood leaks out of the vessel. Platelets act as the first line of defense and gather together to form a plug in the hole to stop the bleeding. If you have hardening of the arteries, also known as arteriosclerosis, there is a narrowing of the arteries as a result of a buildup of deposits in the vessel wall. So the flow of blood is impaired and the platelets can plug together in the narrowed artery, causing a clot. If this happens in the vessel leading to the heart, it can cause a heart attack. Antiplatelets interfere with the platelet process and help prevent clots from forming in narrow arteries. But platelets are only one part of the clotting process, which is actually quite complex. After the plug of platelets is formed, your body then creates a mesh out of a substance called fibrin. The mesh traps more platelets and cells within the blood. Anticoagulants such as the DOACs, Warfarin, and Heparin interfere in the creation of the fibrin mesh. Occasionally, you may need something called an unfractionated heparin infusion, which is administered intravenously, that is, into the vein. Why, you might ask, if you can take a tablet like Warfarin, would you need an unfractionated heparin infusion? Well, firstly, unfractionated heparin infusions are great for people with poor kidney function. They're also sometimes used for people with mechanical heart valves, but this will depend on the advice of your doctor. What's important to understand about unfractionated heparin infusions is that they have what we call quick onset and quick offset. This means when you put the IV in and administer the heparin, it starts working very quickly. And when you stop the heparin and take the IV out, it stops working very quickly. It's a bit like a switch that you can turn on and off. If you're going in for a procedure like surgery, you may need to come off your regular anticoagulant to help reduce bleeding. It takes a few days for these anticoagulants to clear your system. During the time you are off your regular anticoagulant, you may be at risk of developing a clot, and your doctors may ask you to be admitted early for an unfractionated heparin infusion, or alternatively, you may switch to subcutaneous heparin injections. Not all procedures require you to stop your regular anticoagulant, so ensure you speak to your anticoagulation team for further advice. If you usually take Warfarin, you'll be carefully monitored by your medical team, who will measure something called the INR. It's a measure of how quickly your blood clots. If you have a metal heart valve, your doctors might decide that an unfractionated heparin infusion is best for your needs. As the Warfarin leaves your system, your team will continue to check your INR to determine when you need to start the unfractionated heparin infusion. A few hours before the procedure, your team will stop the unfractionated heparin infusion so that they can carry out the procedure safely. Once the procedure has been successfully completed, they put you back on the heparin infusion and start giving you your Warfarin again. It takes a few days for the Warfarin to take effect, so your team will continue to monitor your INR and make sure the Warfarin is working as it should. The heparin has acted like a bridge to keep you safe whilst off the Warfarin.